thank you all for sharing your time with me, and I'm really honored to be on this program, and I'm building off work that's been done by many of you in the room in terms of research, but also in terms of policy, and I'm inspired by your work in my own. So this is joint work with Juan Chaparro, who's a PhD student at Minnesota, who's going on the market, and all of you guys should be fighting over him because he's terrific. The work couldn't be have done without support from the Irvine Networks for Interventions and Development, Greg Duncan. So thank you all. So enough preliminaries. So today I'm going to just outline, we're going to talk about the evolution of skill gaps, income-based skill gaps in child skill. So we're going to talk about a particular intervention, a random assignment experiment that was done in the mid-'80s. Some of you were leaders in this, called the Infant Health and Development Program, IHDP. It recruited families in hospitals giving birth to kids, and it offered a third of them a treatment, 2/3 a control. For the first year of the kid's life, free home visiting program. For the next 2 years, from 12 months to 36 months, free access to very high quality care. So the woman who spoke up earlier about the importance of 0 to 3, this program ends at 3. And the previous two speakers were giving you a very high level view of the field, which is incredible. I'm going really deep into the minds and coming back up with some new information, hopefully. This intervention produced very different, so it's the same program for everybody. It's the same offer of a bundle of services to everyone, but it produced very different effects on kids. And this paper is about trying to understand why and trying to unpack the evidence and the theory on what's driving these differential effects. So this is your chance to get your pen and paper, write down your theories. Why did some kids have big gains from this and other kids not so much? This is inequality at the starting gate, early evidence that family income has a strong determinant on child skill. Kids whose parents earn in the top 20% have more than a 1 standard deviation advantage over kids whose parents earn in the bottom fifth at the beginning of kindergarten. Okay, so if you're starting at 5, you're starting late. These income-based gaps open up very early. This is recent evidence from a neuroimaging study that followed kids as they developed from 5 months up to 36 months and measured the volume of their gray matter. And the top line is kids from high SES families, and the bottom line is kids from low SES families. You can see at the very beginning, brains look similar, at least by this one measure, but these gaps open up. And at age 3, they're there. It's happened. This echoes earlier work by Hart and Risley about child's vocabulary gaps opening, and it echoes, they pointed to one explanation of an input difference that drives this output difference, the number of words that are addressed to a kid. And, kids with professional parents hear a lot of words. Kids with low SES parents were hearing many fewer words. This has driven the 30 million word gap frame. This is correlational evidence, but there's been a lot of supporting work building on this, and clearly the evidence is that early environment can matter. But we see these really strong correlations. These gaps are very stubborn and persistent. There's a lot of attention to this in Minnesota, really trying to address these gaps, and it's resisted many good efforts. So the question still remains, is it possible to address these gaps and prevent them from appearing? The IHGP was one effort that was meant to intervene early in life and affect development. As I said, they recruited kids at birth and randomly assigned a third of them to get a treatment. an offer of free weekly home visits, not by nurses, these were by trained staff. From what I've seen, I don't see much evidence of effects from that first year of home visits. So there was no effect on the home environment. There was no effect on measured child skill at age 1. The second component was free access to high quality childcare, abecedarian curriculum, full day. They also worked very hard on developing free transportation networks. Anecdotally, this was very important in encouraging take-up, and that's something that's not built into many programs. So a nice thing about this sample is that it was not selected on the usual thing. The usual thing is selected on income. We know a lot about these kinds of programs for low-income families. This was selected on a different dimension. So you ended up with an economically diverse, racially, ethnically diverse sample, but it was selected for low birth weight. That was the margin of selection. So it's all low birth weight premature kids, but from a variety of economic backgrounds. So this is the distribution of birth weight, and what they found was it was built into the original design to stratify into sort of a high low birth weight group and a low birth weight group, and they found bigger effects for the high low birth weight group and more persistent effects into up to age 18. Greg Duncan and I had a paper a couple years ago where we reanalyzed this data. We focused on the high low birth weight group. We stratified it by family income. So we broke it into a low income group below 185% and a higher income group above. And what we did, this just represents some of the stuff in the background of that study. What you see here is child age, and the fat line is the average in the control group. This is going to be for low-income kids first. At age 1, there's a small positive difference, but it's not significant. But after a year and 2 years of this access to high-quality childcare, the effects on child IQ are just enormous, okay? This closed the achievement gap. This closed the skill gap as measured by these the best cognitive skill measures available. The kids in the low-income households who had access to these centers through random assignment were performing above or at the same level as high-income kids in the control group. So genetics, all that, these low-income kids were performing at the same level as high-income control group. The intervention ended at age 3, okay? So there's no more continuity, no more alignment. Certainly it would be better probably if there was, but it would have costed more money too. And so, you know, we have to think about where to allocate our resources. More is definitely better than less, but here's some evidence about investing very early, and there's not a lot of evidence out there that's this relevant for that question. So what happened, do you think, at age 5? 2 years after the intervention ends, kindergarten entry. What happens at 18? At age 5, there's still a 60% of a standard deviation effect on child IQ. It's still significant. That's enormous. That's like 3/4 of the income gap. Even 5 years later, there's still a big effect. Even 15 years later, this isn't significant anymore. There's a third of the sample attrited, but the point estimate is there. What do you think was the effect for high-income kids? So that's all low-income treatment versus control. Now what about kids from high-income families or higher-income families? So this is in red. You can see no effect at 1. These are actually big effects, 0.4, 0.3 IQ standard deviation, but they look small because the low-income kids were just off the charts. But then 2 years later, after it ends at kindergarten entry, no significant effect. 5 years, 15 years later, no significant effect, okay? So what drives these differences in the effect? It's the same offer of services. It's the same services. They set up a child development center in each of the 8 cities, and they ran it, and the kids were going to the same centers. The same staff, you know. The differences are driven by differences in parental choices about how much to take up. This builds off the difference between intended and received. There are differences in the home environment outside of the CDC, the Child Development Center. And there's just all kinds of differences between low-income and higher-income families. And it's very important to understand what's driving these differences if you want to design good policy and just for interests of science. So in most data, it's very hard to see all these different ways that families are different, and it's very hard to see all the different ways that families adjust and make different choices outside the center. But thanks to the foresight of the original PIs, they collected tremendous data across a broad range of dimensions of parental response and child development, and it's very rich data. It's really cool. So that's where I've been for the last 10 years. Okay, so to interpret this very rich evidence, there have been a whole series of papers looking at the effects on this, the effects on that. They haven't really been stratified by family income other than the IQ paper I told you about. So we develop an economic model of the choices that parents face, the environments they face, and the choices that they have to make about how to allocate their time, their energy, their money, and how that translates into child skill, and how that translates to adjustment on different margins. So it's a very simple model, one child, one mother. I apologize for focusing exclusively on mothers. That was one thing they didn't do very well. They didn't collect much data on fathers. There's really good data on mothers, though, so I apologize in advance. I'm going to talk a lot about mothers, not for want of curiosity. So child skill in this model is produced through a series of inputs. Things that are determined prenatally, reflected in birth weight, and postnatal investments. So a key aspect of the model is that the child has a time budget, okay? They have to be cared for all the time, but they only have so many hours in a day in which to experience different environments. And the quality of the environments that they experience have consequences for their development. And so we should think about that as a scarce resource. We should think about kids' time as an opportunity and a scarce resource that we don't want to miss out on. Mothers have a time budget. They can either work to earn, they can parent, or they can do other things. And mothers choose how much maternal care to provide and have some influence over what quality of maternal care to provide. They choose how much non-maternal care to provide, in what setting, what quality, and they have to make trade-offs. Very good non-maternal care is expensive. More of it is more expensive. Maternal productivity, mothers face a choice about how to use their time. Should they go earn or should they stay home and parent? Most of you are probably parents. You know that it requires effort. You can do a really good job for 30 minutes, but if you have to do it for 17 hours, it takes a toll. It's hard to maintain. And so building in an effort choice is important because it recognizes how these trade-offs are made and how some channels by which these programs might have effects. So I think the key idea of the model that's really important is that it represents the treatment as the offer of a given level of quality of care, a given maximum amount of care that you can take up, and a price. And then it lets families choose what to do in reaction to that offer. And that's important because it generalizes this away from one program, and it's a model that fits many programs. It's a model that you can characterize many programs in terms of quality, quantity, and price, and you can start to predict how families will react and how the consequences that'll have for child development. So there's going to be some math here. So the important thing here is that there's different kinds of care. There's maternal care, non-maternal care. If you're in the treatment group, you access this Child Development Center. It's free, it's high quality. That's a parameter that the policymaker sets, the designer set. And what matters for developing child skill is kind of the effective units of care. So how much time did they spend in what quality of environments and what kind of environments? But there's no distinction between the IHDP and other forms of non-maternal care except through this quality parameter, which you can tell that's carrying a heavy load. There's obviously tons of differences, but I'm extracting from many of them. Parents face choices. They choose, they have many things that they value and care about in their lives, and some of those are, you know, spending money on stuff that's not childcare, like rent and food and you know, clothes and whatever, transportation, everything except childcare. That's consumption. They care about having some free time where they're not parenting and not working. But they do care about their kids and their kids' skill development. They care about how much effort they're exerting towards parenting, creating quality maternal care environment, home environment. And then there's kind of a taste, like a stigma parameter, sort of something to capture why people might not take up all the free, high-quality care that's available. It might be they work in the evenings. It might be they have kids in other care settings, and it's hard to coordinate. So then these are the constraints. So this is what they care about, and they're trading off these different values, okay? And it's hard, and people have to make tough choices. You can't have everything. As an economist, that's what we preach. And you have to make choices. And if you want to understand how people are going to react to a policy offer, you have to think about how people are going to react and how are different people going to react differently. So there's a child time budget, a mother's time budget, a money budget where you can earn money. Your wage is W times labor, L, non-labor income, and then pi QNN, that tells you how much you're spending on market-based care, and C is sort of what's left over in your budget after you pay for that. Skill production happens to create child skill through a combination of these quality and quantity of different care, and also sort of child status at birth and embodying prenatal influences. And this, and the parent gets to choose how much time to take up at the CDC, and so that they can choose T up to this maximum, which is set by the program people. You can think about this with other programs too, in many forms. And then parenting takes effort, and productivity between the labor market and parenting might be correlated. So here's the key expression that I want to focus on. A lot of economics modeling these choices. It's an abstraction, but I think it yields some insight here. So this T equation tells you about the choice about how much to take up this free offer, okay? And what it says is that there's costs and there's benefits. And the benefits are, the first term tells you about the benefits in terms of incremental child skill. So how much does taking your kid out of an alternative care setting for an hour to send them to the CDC care setting, the subsidized setting for an hour, how much different is the quality? That's the quality gap. It might be positive, it might be negative, depending on what their alternative care environment is. And it's valued at a certain amount by a parent relative to other uses of resources. And I know that's well, I imagine some people don't like that, but maybe you all love it. But it's true that parents have different values and different beliefs about how things work. And so that's sort of reflected in these marginal rates of substitution, which embody the relative weight parents put on all the things they care about. So the first point is one of the benefits is in terms of child skill, and it really depends on this quality gap between the quality of the subsidized environment versus the, the lost hour they would spend somewhere else. The second benefit is it frees up the mom for an hour, or the parent for an hour, and she values that time, and we should all value that time. That's not nothing. We talk about subsidized childcare is free, is expensive, but parenting is also costly. It takes up people's time and their energy, and it's worth valuing. The last thing is that it gives them a sense of relief. They don't have to parent for an extra hour on the edge, and that gives you a little more space in your head to do other things. I've been there, I'll tell you. That's no offense to my kids, I love them dearly, but that happens. So the cost is this stigma parameter. So there's more there, but that's the main point. And I refer you to the paper if you want to get deep in the weeds on that. Okay, so I think the model has value just in terms of illuminating the choice problem families have and highlighting how policy interacts with families' choices and thinking through that clearly. So what we see is that I showed you one representation of the differential effects. Here's another one. So on the bottom we have a measure of the mother's potential wage. So not all the mothers in the IHDP work. They didn't measure their actual wage. I think they didn't have any economists on their team. But what we did is we went to the current population survey in the mid-'80s, looked at mothers of young children, looked at how education and experience and family structure and all this related to wages and estimated a sort of selection-corrected Hecate, and take that model back to the IHDP data and score everybody. So now we have an estimate. It's like a proxy. It's a noisy measure of if you were going to work, how much could you earn? And it's basic. You can think about it like maternal education. That's a big driver. And what you see is that on the vertical, you have age 3 IQ of the kid. And you see that for low-wage moms, the kids of low-wage moms, the effects are huge and significant. And for children of higher-wage moms, you just don't see that effect, okay? So what's driving that difference? Here's where the IHDP, the data is very rich and interesting. And I'm going to show one graph that tries to summarize a lot of this. So here we have, on that side, the far side, is talking about the children of mothers who are in the bottom third of the wage distribution, okay? The bottom third of earners. And the vertical tells you how many hours the kids are in various care settings. So in the control group, that's the first bar, it says that the kids are spending about 67 hours a week. It's about 12 hours a day, 7 days a week that kids have to be cared for. They're spending about 67 hours a week in maternal care. And they're spending about 21 hours a week on average in alternative settings, market-based care or non-maternal care. Could be fathers or grandmothers, but it's largely market-based care. Then go to the second bar. That shows you the treatment group for low-wage kids from low-wage families. And what you see is that they take up an average of 16 hours of care in the CDC. They're offered 40, they only take up an average of 16. And this is super high quality, okay? And so that's interesting. What does it crowd out? It crowds out 11 hours of maternal care a week on average, crowds out 5 hours a week of market-based care on average, okay? But go over to the third and fourth graph. So there you have the top third of the earners and their kids. And what you see is that, so instead of 67 hours a week of maternal care, their kids in the control group are getting 60 hours a week. So that's, high-wage moms work more, Their kids are in 27 instead of 21 hours a week of market-based care in the control group. But in the treatment group, what's interesting is that the take-up isn't any different. So it's not that the high-wage moms are sending their kids to the centers less. They're sending them just as much. It's that it's crowding out a different thing. And that because for the low-wage families, it's crowding out maternal care. For the high-wage families, instead of crowding out 11 hours a week, it's crowding out 5 hours a week of maternal care. Instead, it's crowding out market-based care. So the high-wage moms are substituting away from market-based care, which is expensive and maybe not very good quality because it's so expensive, and they're replacing it with this high-quality care. But so there's this differential crowd out. I think that's one big finding from this study and I think one big driver of the effects is that it's not differential take-up, it's differences in the alternative settings that are crowded out by the care. So there's also evidence of effects on maternal care quality. So I bristle at the term, but this is sort of quality of the home environment, learning and literacy factor identified by Brooks, Gunn, and Lindver. And what you see, which is I think really interesting, is you see that for low-wage families, there's a big effect of the treatment on the quality of the home environment at 3, the quality of the care environment at age 3. There wasn't one at age 1 before the center started, after a year of home visiting, but there is at age 3. And so we can think of different stories for this. So like Brofenbrenner, maybe evocative effect. The kids go to the schools, they get charged up, they come home and evokes better environments from at home. There's also the story of this effort channel that basically by reducing the amount of care that moms have to provide by 11 hours a week on average, they're able to parent better. They have more resources psychically to do that. And I think that's a really important story about what's going on in these settings that's underappreciated. Okay. And you don't see it for the high wage. So this just summarizes. We also looked for evidence of heterogeneity and effects by prenatal investment levels, which are meant to proxy for taste. So how much report of drug use and alcohol use and cigarette use did the mothers report prenatally as sort of a proxy for how much they know about child development, how much they value that skill. And we don't find any evidence of that, really. So that's not the thing that is driving these different effects. It's not differences in taste. It's not differences in the birth weight shock. We go to the early childhood longitudinal study and do a similar exercise where we estimate the relationship between birth weight and inputs and maternal characteristics and then score the IHDP families and measure their birth weight shock. It doesn't seem like that's what's driving the heterogeneity. It's really about the value of the mother's time or her human capital and the alternative care settings that they would be in otherwise. So in future work, I hope to use this model directly in the IHCP data. We're working on this now to estimate the distribution of effects. And what's cool about it is that it gives you a model of decision making, and then you can predict the effects and the distribution of effects of alternative policies. So maybe lower quality care subsidized full day, or high quality care subsidized for half day, or middle quality care that's subsidized partially, 50%. So we have innovative policy in Minnesota, the early learning scholarships. We put down a lot of money on this. It's not fully funded. It would be great to understand what's out there. What are we learning from this experience? From basic sliding fee, CCAP, from universal pre-K programs, Head Start, early Head Start, any of these data sets you could basically interpret through the lens of this model and get information about, and to be able to predict impacts. The other thing is, when you look at those graphs, the really important influence on child development, the big resource that influences their early experience is the parents' time. They spend a lot of time with their parents. So anything that can be done to support, and parents want to do the right thing, but a lot of them, they just get crushed in the day and the press, and it's hard to keep these priorities top of mind. And so things we can do to support families in using those their resources better and giving them more resources would help. So these are very general conclusions. Investments influence child development. This stuff is not baked in the cake. These gaps are produced through our choices. Second, child time is precious. It's a scarce, important resource, and we should use it well. Third, policy design demands that we take account of differential response of parents. If we want to understand and predict what's going to happen, it's not just enough to sort of legislate what we want. Parents are going to react to those things. Child care subsidies make all parents better off. It gives them more options, but it doesn't necessarily make all kids better off. It can have you can make things worse, can make things better, it can have no impact, depending on the alternatives. And last, offering relief for parents opens up space for them to parent better, I think. So, thank you.